Shelley Petit is the chairperson of the New Brunswick Coalition of Persons with Disabilities. Today, she joins us to talk about the social assistance issue in New Brunswick. Shelley talks about what should be done for the social assistance reform. Here is what she has to say.
So there's just so much. So I represent the Coalition of Persons with Disabilities, and we're 26.7% of the population. We're well over 1/4% of the population. And so many of us are unable to work, some because our bodies won't let us, some because employers don't understand what accommodations are required and that they're often not really expensive accommodations, that there's funding for a lot of it. So a huge chunk of us end up on social assistance. Out of that number, only 30% qualify for what's called extended benefits, which is about $100 additional a month. So whether you're getting $726 or $832 a month to live on in New Brunswick, it was not enough prior to the inflation that we're seeing now. It's certainly not enough now. You can't afford to get a place to live. You can't afford food. You cannot afford transit. Most people are not taking their medication. So what's ended up happening is we're robbing Peter to pay Paul. So not only people living in well below the poverty line. If you take what we would get for a year on social assistance, we're almost $11,000 under what you would need to hit the poverty line in New Brunswick. Just to hit the poverty line is we would have to increase what we receive in a stipend by 1.5%. Nobody's asking to go on trips. No one's asking for big luxury items. That's just to hit the poverty line. That's not a lot to ask for, I wouldn't think, in Canada. So then if you're not able to get that, you're living in slum places that are not healthy for the body. We know that well over 50% of New Brunswick housing homes have radon and or mold issues in them. So that's just adding to health issues. We're not eating properly, which adds to health issues. We're not getting our medications, which adds to health issues. So all that's going to happen is if in a couple of years' time, if people think that the medical system is a disaster now, wait for the repercussions of these shortages to persons with disabilities and persons on social assistance and what it's going to do. I mean, we have 500 people on the street in Moncton? Like shame on New Brunswick, shame on this country and this province for allowing that to happen.
So why is the social assistance rate so low in New Brunswick compared to other Atlantic provinces?
Well, that's a good question. We've tried to have that conversation with the government. They really don't want to discuss it. Right now, they are under the understanding that the Canadian disability benefit's about to pass and that's going to raise income. So why would they put out a penny if this is coming? The problem is that's a regulatory bill. And maybe some of our government doesn't understand what that means, but it means that after it receives royal ascension, it's going to take another year or so to put all the policies in place because they need a separate policy with each province and territory because they have different items available. So that being said, the government of New Brunswick is going to go, well, we're not going to put more money and we're going to wait for the feds to do our job for us. But the feds are not going to be able to do that until probably 2025. How many people in New Brunswick are they willing to have die? How many people do they want in New Brunswick to go out and seek MAID, like they have in other provinces, to die through medical assistance, not because our disability is too severe, but because we can't live like this. You can't live on the street in a power wheelchair. Where are you supposed to charge it? Like, it's just ableism. It's systemic ableism. It's this fear that maybe somebody's going to try and take advantage of the system. Nobody wants to live like this. Nobody. If we could be out and about, we would.
Despite the province currently sitting on a $774.4 million surplus, why do you think the government is not doing much to address this issue?
I think it's because it doesn't affect them personally. It's really hard. One of our slogans is nothing about us without us. As someone that's relatively new to the disability world, like in 2019, I went to bed one night healthy, woke up in the morning disabled. This happens to many people. Until you live it, you don't 100% get it. And I think that's what it is. They don't get it and they don't want to understand. It's easier not to understand because then you don't have to put the money in it, right? It kind of goes back to the Minister of Social Services saying about 2 weeks ago, well, we had no idea there's that many people living homeless in Moncton, even though they've been given the numbers over and over. They wanted to work with a smaller number because that fits their narrative better. So it's easier for them to say persons with disabilities, they really don't need that because we have other items out there. Okay, fine. So we have home care, but nobody ever comes because there's no home care employees. Or we have housing benefits, but you cannot find a place that fits within the recommendations. So there are other benefits, but we can't take advantage of them, or you cannot find them because they're so well hidden.
Mhm. Can you tell us about the market basket measure, like how it is related to the social assistance rate and the
Yep.
poverty line? Yeah.
Yeah, so the market basket measure is one of the ways that they measure poverty lines. And it's basically like, this is what you need to fill your basket of life with the bare necessities. So bare housing, public transit, no luxuries, food that you need. In New Brunswick, they broke it down based off rural, mid-sized cities. Then they looked at the most expensive city, but it's rounding around $21,000. That would be the bare minimum that you need to just have your basic needs met, to hit that poverty line. In New Brunswick, if you are on extended benefits, you run about $11,000 short of that. If you're on regular social assistance, you're running about $13,000 or so short. And that's just, it's unacceptable. These should be the bare minimum of meeting our basic needs.
Mhm. So what are the demands of your organization for the provincial government?
Okay, so we worked with the Common Front on Social Justice, and we want to see social assistance rates brought up to
Mhm.
the market basket measure, right? So the poverty line, it's not like anyone's asking for anything luxurious. We would also like to see it tied to inflation, which they've finally done that much. They did that last October, but inflation's never enough because we know some things go over the inflation mark. So we'd like to see 2% above the current inflation mark. Those are some of the big ones we've asked that, things within the government, that it's easy to apply for extended benefits, that it's easy to find the benefits that are out there, because these are things that don't happen, that it's easy to qualify for the services, because when 70% of people with disabilities are denied extended benefits, is it really a benefit anymore? Or is it just something for the privileged few? Right? People in wheelchairs are being denied and told, oh, well, you're not really disabled. Well, then what am I?
Mhm.
They ignore mental health as a disability, even though it's a disability. Until last week, they wanted to ignore that long-term COVID is acting as a disability for many people. The government also wants to completely ignore what's called episodic disabilities. So if you have MS, you may have a flare-up and then be good for 2 or 3 years, and then another flare-up. It should be very simple to be able to work when you're feeling well, and when you have a flare-up, it's one phone call and everything's put back in place. But they are so worried that one person may cheat that all the rest of us have to suffer.
Mhm. Mhm.
And it is suffering. People are dying from this.
Right. So what do you think should be the minimum wage for people with disabilities? I read like maybe it's $20. Do you think it should be more or?
Well, it is, we know it's more expensive to live with a disability.
Mhm.
I know that a lot of people who are out working, earning minimum wage are gonna say, well, whoa, 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 why should you get that much to stay home and I'm out working? And
Right.
I get that. And I think that there's a couple things that have to happen. The government has to work with us, as we've been asking, for people who are able to work and want to work, to make it easier to work.
Mhm.
For many of us, it would be part-time, but make it easier to work. People want to work. They want to be able to leave their house and have that sense of accomplishment. Just by doing that and then increasing minimum wage to a livable wage. I mean, the government has to accept responsibility for the fact that They were the ones that let all these people move into New Brunswick, drive up our housing costs, which has driven up the minimum wage that we need to survive now. And whatever that is, right now it's measuring about $20 an hour. It should be for people who are working at minimum wage, and it should be for people that need assistance, because that's what defines us as Canadians. We help people when they need help, and when we can help, we help out.
Right. Why do you think the provincial government should abolish the household income policy?
Well, it's not 1965 anymore. So this was created back in the 60s when, unfortunately, men who had disabilities were often put away into residential facilities, not seen anymore. Women who had some disabilities but were still able to have children were kept out in the public, were married off to a husband, and became the husband's responsibility. That's not how it works anymore. Women should be responsible for themselves, and husbands, whoever has the disability. They should not be seen as the property of someone else and that they're that person's responsibility to care for, because that's what the household income policy does. The other really cruel thing it does is it says, so let's say I was going to get married and I'm on assistance. I would have to cancel my current plan, get married, reapply, and hope for the best. Let's spin the wheel and see what we get today.
Right.
Because any day you call in, you can get a different answer on that. There's no consistency. There's no letting people know beforehand. Just develop a married couple's amount that is reasonable and allow people to get married. Think of how many units that would open up, because people with disabilities have to stay single and not living with their partner. How many units could we open up by allowing people to get married and move in with their partner?
Right. So what are the solutions that you see, to fix this issue, and also to bring the government on board? And,
I don't know if the government will ever be on board with us, because this current government just doesn't want to hear it. We've met with them too many times. We've got video Premier Higgs saying, I don't know how you live on that a month, but yet he won't do anything to fix it when he's sitting on this type of surplus. We need to increase the rates to a livable amount to bring people to the poverty line. When you're talking about persons with disabilities, the provincial government has to lead the way and hire people with disabilities to work the oodles of jobs that they have sitting open that we can do. Allow people to work part-time, allow people to earn a reasonable amount when they're on social assistance, because that money just goes back into the pockets of New Brunswickers. We re-spend that in the province, pay taxes on it, increase businesses, and truly listen to people with disabilities, and listen to people who are homeless. Nobody woke up this morning and said, hey, I think I'm going to become a drug addict and become homeless. Nobody does that. It happens for reasons. Actually listen to those reasons, instead of talking about building more jails just to punish them, because that's not going to solve anything. It didn't work in the 80s and it won't work today.
Thank you so much for joining us today.
Thank you very much. Anytime. Have a good day.
And that was Shelley Petit joining us today, talking about demands for social assistance reform in New Brunswick and what should the government do to fix the issue. For the NB Media Co-op, this is Arun Budathoki.